Hi, I'm Dr. Jeff Burns. I'd like to talk to you today for a few minutes about replacement of missing teeth. People come into my practice all the time missing either one or multiple teeth, and for today's conversation we'll just narrow this down to the missing of one tooth at a time. When people come in, I always try to give them all the options that are available to them. I try not to bias in any way, shape, or form, and just try to give you all the information so you can make a well-informed, educated decision. One option, if you're missing a tooth, is simply to leave a space. And while that's the simplest, easiest thing, it's certainly not the best option. And there are many things that can happen down the road that can complicate issues in your mouth, leading to other tooth loss and problems with the bite, decay, etc. So while that's an option, certainly not the best option. Another option for missing teeth replacement is to do what's called a removable appliance, a removable partial denture. We call it an RPD. Very nice, easy option to go with, relatively inexpensive. The problem with the removable is that it is what it is. It's removable. It comes out at night, should come out at night. You will find that it doesn't stay in very well. It works to replace a tooth. It holds a space, which is one of the things we try to do. But on the other hand, I find that most patients find their partial dentures fit really well in their sock drawer. They don't wear them. They're difficult to wear. So while that is an option, certainly not one of the best options we have available in dentistry these days. I like to go with what's called the fixed option. One option within that realm of fixed, there's two different options. The first is called a fixed bridge. And a bridge is a prosthesis, an apparatus made that gets cemented into your mouth, replacing the missing tooth. It's a pretty simple, pretty straightforward option. We can do that usually in 2 visits. We find that it looks good, it functions very well, and people are generally pretty happy with it. The downside of a fixed bridge is that we have to attach to the teeth on either sides of the space. When we do that, we have to prepare those teeth for crowns. And many people come in with missing teeth that have had just one bad tooth in their mouth. And what we have to do then is be invasive. We have to drill down essentially the other 2 teeth to get this bridge to fit on there. What we find in that we're being invasive, we're preparing other teeth for crowns, is that we can end up having problems with these teeth down the road and kind of create a domino effect where you may end up losing other teeth. We find that because we prepare these teeth, the nerves may go bad, you may need a root canal, which may be where you started off in the first place with the missing tooth. The other thing that I try to explain to patients when we do a bridge is that the bridge that we put in your mouth is basically the same as a bridge that you drive your car over, any bridge out there. We have to deal with the engineering of a bridge, we have to deal with the physics of a bridge, and very simply what we're talking about is a flexure of that bridge. And no matter how strong material we use, there is going to be flexure in that bridge, and in that flexure, we're going to find that we break down the cement seal on the crowns and we get some leakage. And the bottom line is we have a very finite lifespan with respect to bridges. The ADA puts out information saying that we're talking about, I'd say 10 to 15 years, maybe at the most optimistic range as to how long a bridge will last. So you'll do the bridge, you'll need another bridge 10 to 15 years down the road, et cetera, et cetera. So it's a good option. I generally tend to try to stay within a very short span of a bridge to limit those issues as far as flexure, but it is a fairly finite kind of thing, and that we will need to replace that down the road. The last option I'll talk about is, not to sound biased, but it is my very favorite option to replace missing teeth, and that is to use what's called a dental implant. The implants have been around for many, many, many years. The current version that we're using has been around for well over 40 years now. It was developed in Sweden by an orthopedic surgeon named Vernon, and we've had this type of implant now for, again, well over 40 years. Very, very predictable, very, very as close to permanent as we have in dentistry right now for replacing missing teeth. The gist of it is this: you have a space that's created by the missing tooth, either because it was taken out a while back or taken out at the time of the surgery. The implant is placed into the space where the tooth was, either at the time of surgery or down the road. Even if you've been missing teeth for a while, we can go back and put these implants in. An implant basically is a titanium screw that gets put into the mouth, and we let that heal. And what we found, what Vernon found, is that over a period of a few months, let's say, the bone actually fuses to the implant. We call that integration or osseointegration. And once that bone fuses to that implant, it's not going anywhere. It's there. It will probably be there forever and ever and ever. So we get this fusion of the bone, we get this integration of the implant into the jawbone, and at that point, the patient comes back for the final restoration of the implant. And what I do is I take an impression of the fixture in the mouth. In my lab, we'll fabricate the parts that fit on top of that. What you end up with is a crown looking like any other tooth in your mouth. It's coming out of the gum and the bone just like any other tooth in your mouth. You can floss around it, you can brush around it. Just functions beautifully, and it works and looks perfect also. The nice thing about it is, one of the things I try to stress to my patients is that you will never get decay on this. It's made out of titanium, gold, porcelain, zirconium sometimes also, and you'll never need a root canal on it because it doesn't have a nerve in it. So it's a really, really wonderful option for replacing missing teeth, one or many missing teeth. I've had cases where I've done a full mouth reconstruction using 20 implants. And it's probably one of the happiest patients I have in my practice right now, because he has a full set of teeth and he smiles and chews and eats and does anything he wants with them. So again, there are many options. I do think that going the route of dental implants is the very best option that's out there for our patients nowadays.